Sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com. What is Bartter syndrome? Bartter syndrome is a rare inherited disorder that impedes the kidney's ability to reabsorb salt, potassium, calcium, and other electrolytes, leading to the excessive loss of all of these compounds in urine. Also known as saltwasting nephropathy, Bartter syndrome is characterized by dehydration, fatigue, cramping, weakness, brittle bones, and hardening of the kidneys, glomerulosclerosis. The disease can be diagnosed with blood tests and urinalysis and confirmed with a genetic test. Treatment is directed at managing the symptoms of the disease on a case-by-case basis. There is no cure for Bartter syndrome. /r/n/r/n Bartter syndrome is named after Dr. Frederic Bartter, who first described the genetic disorder in 1962. /r/n/r/n There are 5 main types of Bartter syndrome, each associated with a specific gene mutation. Depending on the type involved, symptoms of Bartter syndrome may be apparent at or near the time of birth, antenatal, or later in life. /r/n/r/n Depending on the mutation involved, symptoms can range from mild, as with classic type 3, to severe, most especially with types 4 and 5. /r/n/r/n The mutations can dictate which type of symptoms develop and whether boys or girls are more likely to be affected. /r/n/r/n Bartter syndrome may become apparent before a baby with the condition is born, showing up as an excessive buildup of amniotic fluid, polyhydramnios, between 24 and 30 weeks of gestation. /r/n/r/n Newborns with Bartter syndrome typically urinate excessively, polyuria, show signs of excessive thirst, polydipsia, and experience vomiting and diarrhea. Although polyuria in newborns can be life-threatening, the kidney function of some babies with this condition normalizes within weeks and requires no further treatment. /r/n/r/n Among the characteristic symptoms of Bartter syndrome, /r/n/r/n symptoms of Bartter syndrome can vary substantially among children, with some experiencing only mild ones. Those with antenatal symptoms tend to far worse, mainly because the loss of salt, potassium, or calcium can interfere with normal fetal development. /r/n/r/n Bartter syndrome is an autosomal recessive pattern, meaning that 2 copies of an abnormal gene from the father and 1 from the mother must be present in order for the disease to develop. /r/n/r/n Bartter syndrome is caused by mutations in one of 7 different genes, each of which is associated with a specific type of Bartter syndrome. Additional mutations may result in subtypes with a different range of symptoms or disease severity. /r/n/r/n The genes are meant to encode proteins that transport salt and electrolytes like potassium and calcium into the kidneys for reabsorption in the loop of Henle, the U-shaped tubule where water and salt are recovered from urine. If the genes are mutated, the resulting proteins cannot transport some or all of these compounds through the cells of the loop of Henle. /r/n/r/n The specific genetic mutations relate to the 5 main types of Bartter syndrome. /r/n/r/n Bartter syndrome is rare, affecting only around 1 of every 1.2 million births. It occurs more often in children born to parents who are consanguineous, closely related. The condition appears to be more common in Costa Rica and Kuwait than in any other population. /r/n/r/n There is little research regarding life expectancy in children with Bartter syndrome, but most evidence suggests that the prospects are good if the disease is diagnosed and treated early. /r/n/r/n Despite the impact that Bartter syndrome can have on the kidneys, renal failure is rare. /r/n/r/n Bartter syndrome is diagnosed based on a review of symptoms and medical history along with various blood and urine tests. Because the disorder is so rare, input from a geneticist, genetic counselor, and other specialists is often needed. /r/n/r/n blood tests to diagnose Bartter syndrome look for low levels of potassium, chloride, magnesium, and bicarbonate in the blood as well as elevated levels of the hormones renin and aldosterone. /r/n/r/n urinalysis looks for abnormally high levels of sodium, chloride, potassium, calcium, and magnesium in urine as well as the presence of prostaglandin E2, a marker for kidney inflammation. /r/n/r/n The antenatal forms of Bartter syndrome can often be diagnosed before birth when polyhydramnios is detected without the presence of congenital birth defects. There also are elevated levels of chloride and aldosterone in amniotic fluid. /r/n/r/n molecular genetic testing can confirm a diagnosis. There are several genetic tests that can detect the various mutations associated with Bartter syndrome, available only through specialized genetic laboratories. /r/n/r/n additional genetic testing may be needed to differentiate Bartter syndrome from a closely related but milder inherited disorder known as Gitelman syndrome. /r/n/r/n The primary goal of treating Bartter syndrome is to restore the balance of fluids and electrolytes. How this is done largely depends on the severity of symptoms. /r/n/r/n Some children require minimal management or their fluid/electrolyte balance may become normal spontaneously without treatment. Others may require lifelong care from a team of providers, including a pediatrician, general internist, and/or nephrologist. /r/n/r/n Sodium, potassium chloride, and magnesium supplements are often used to correct electrolyte imbalances. Other drugs may be prescribed to treat inflammation and low prostaglandin levels that promote excessive urination, such as nonsteroidal anti-inflammatory drugs, NSAIDs, like Advil, ibuprofen, Celebrex, Celecoxib, and Tivobex, indomethacin. /r/n/r/n Stomach acid blockers like Pepcid, famotidine, and Tagamet, cimetidine may be needed to reduce the risk of ulcers and bleeding caused by long-term NSAID use. /r/n/r/n Other drugs, such as aldosterone antagonists, angiotensin II receptor blockers, and angiotensin-converting enzyme, ACE, inhibitors, may be needed to reduce renin levels and the risk of kidney damage. /r/n/r/n Depending on which electrolytes are imbalanced, some people may require potassium-sparing diuretics such as spironolactone or amiloride to increase the excretion of sodium in urine but retain potassium. /r/n/r/n Kidney transplant can correct severe abnormalities and has, in rare cases, been performed when someone has developed the complication of renal failure. /r/n/r/n Infants with severe, life-threatening symptoms may require intravenous, salt and water replacement. Children who fail to thrive often benefit from growth hormone therapy to overcome growth retardation and short stature. Cochlear implants can be used to treat deafness associated with Bartter syndrome type 4. /r/n/r/n In addition to supplements and adequate hydration, children may be encouraged to eat foods high in salts and potassium, with monitoring. /r/n/r/n As a child with Bartter syndrome gets older, the condition generally becomes easier to manage. /r/n/r/n The outlook for people with Bartter syndrome is generally favorable. With management, most people will go on to live normal lives. /r/n/r/n A 2022 review concluded that early diagnosis and treatment of Bartter syndrome may prevent long-term consequences such as growth failure, overdeposition of calcium in the kidneys, and end-stage renal disease. /r/n/r/n The outcome of the 2022 study that followed people with Bartter syndrome from 1996 to 2020 found favorable results after treatment, leading to metabolic normalization and completely recovered growth in 71% and partial growth catch-up in an additional 14%. /r/n/r/n Bartter syndrome is a rare and potentially serious genetic disorder that, if detected early, usually can be managed with diet, medications, and supplements. Even when symptoms are severe, there are treatments available to help restore hearing and correct severe kidney dysfunction. /r/n/r/n The outlook for people with Bartter syndrome has improved considerably in recent years. With proper, lifelong management of the disease, including adequate hydration and the maintenance of electrolytes, most people with Bartter syndrome can avoid long-term complications, such as renal failure, and live normal, productive lives. /r/n/r/n/r/n/r/n Thank you. Form.email, for signing up. /r/n/r/n There was an error. Please try again. /r/n/r/n rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.